Good morning, students. The previous class we have seen the functions of nursing. No, sorry, the definitions of nursing. So here in this class we will see about the functions, qualities, categories of nursing personnel. So the first one is as functions of a nurse. First, as a caregiver. Caregiver means one who gives the care. So assess the patient physically and psychologically, provides direct care and shows concern for the patient welfare and acceptance of the patient care. Second, as a counselor, helps the patient to recognize, cope with the stressful psychological or social problems to develop an important interpersonal relationship and to promote personal growth, provides emotional, intellectual, psychological and support. In the beginning or from the previous experience, you may only have nurse as a caregiver, but who give the care to the patient. But our role is very important as a counselor. So we can educate the patient about the good habits, and also we can hear them if they have any stressful situation, or if they're newly diagnosed as a cancer or something, they may have a stress in them. So it helps us psychologically, it help them to cope up with the new situations. Third, as a protector and a clinical advocate, protect the patient's rights. Involves concern of actions on behalf of the patient to bring about a change. That means if there is any procedures which is going to harm the patient, or it will increase the patient's suffering, the nurse can always be an advocate for the patient. The clinical and ethical decision maker is an advocate of a patient and family that makes clinical and ethical decisions for ultimate benefit of the patient and secure patients' health care rights and stand up for them. Then, as a change agent means the person who brings the change. We can bring changes in the habit of the patients, attitude of the patient, knowledge of the patient. So it's initiate the changes to assess the patients to make modification in themselves or in the system of care. Then as a case manager, make decisions, coordinate activities of others, allocate resources, plans, give directions, develop staff, monitors operations, give rewards fairly and present both staff and administration as needed. Then as a rehabilitator, plays an important role in restoration of health of the patient. You may be quite unfamiliar with the term rehabilitation. Rehabilitation means once a patient is having some problems like loss of a limb or amputation, then he has to cope up with life. That is the rehabilitation, which helps the person to come out or overcome the shortcomings of. So with that, the nurse works with the patient to regain the health status as close as possible to the pre-morbidity. Whatever accident happened to them, but we cannot replace the leg, but we can bring back the health as close to the pre-morbidity stage. Then comforter helps in promoting comfort of the patient and family during the period of care. Then communicator supports the patients to the healthcare team and support people in community. Nurses communicate with the clients, support persons, other health professionals and persons in the community. In the role of communicator, nurse identify client problems and then communicate this verbally or writing to the members of the health team. The quality of nursing communication is an important factor. There is another chapter for you about the communication. We will learn in detail about the communication, its advantage, hindrance, types, all this in that lesson. The teacher provides information and helps the patient to learn or acquire new knowledge and technical skills. Interprets information to the patients. We have to educate the patient about some new knowledge, or if for example skills, like if the patient is newly diagnosed as diabetes mellitus, at home he or she may have to take insulin injection. There is no one to help them, then we have to educate the patient how to take injection self. So technical skills also we have to teach the patient. Then as a leader, coordinate the activities of the members of the nursing staff in the delivering nursing care, personal policies and budgetary responsibilities for a specific nursing event agency. Then researcher participate in identifying significant researchable problems. If there is any problems which need to be researched or it need to be followed up, then we can do the research and bring the changes and bring the findings, and so that we can change the existing pattern. Then qualities of a nurse. To become a good nurse, the person should be self-confident, humble and honest, loyal, cooperative, good listener, keen observer, good administrator, good supervisor, impartial, capable, good workmanship, and responsible, accountable, competent, goodly judgment, and an advocate. Sometimes these qualities may not be seen in us, but as the time goes, we can develop these qualities and become a good nurse. Professional responsibilities and roles. First one is autonomy and accountability. Autonomy is an essential element of professional nursing that involves initiation of independent nursing intervention without medical order. That means we can do something without another person giving order to us. For example, if a patient is suffering from fever, there is no need for the doctor to come and order for putting a cloth dipped in water on the forehead of the patient. That is an autonomy function of the nurse. When we independently implement coughing and deep breathing exercise for a patient who recently had surgery, a patient who is going for a surgery, we can educate the patient how to do the deep breathing and coughing exercise. So it will help them when they come after the surgery, help them to prevent the pooling of secretions in the lungs and prevent pneumonia or any other infections. With increased autonomy comes greater responsibility and accountability. Accountability means we are responsible professionally and legally for the type of quality of nursing care we provide. If we give a medicine to a patient, we are responsible for that. We cannot we can't put that blame on someone else. If we do whatever we do, we are responsible, and legally, that is not only ethically and legally also we are responsible. Then caregiver. As a caregiver, we help the patients to maintain and regain the health, manage the disease and symptoms, and attain maximum level of function with independence through the healing process. Then we need to meet all the healthcare needs of a patient by providing measures that restore a patient's emotional, spiritual and social well-being. Then advocate. As a patient advocate, we protect our patients' human and legal rights and provide assistance in asserting these rights if the need arises. For example, we provide additional information to help the patient to decide whether or not to accept a treatment, to go for a surgery or not. Then educator. As an educator, we explain the concepts and facts about health, describe the reason for routine care activities, demonstrate procedures, their self-care activities, reinforce learning for patient behavior, and evaluate the patient progress in learning. Then communicator, that we have already seen. Our effectiveness as a communicator is central to nurse-patient relationship. It allows us to know our patient, including their strength, weakness, and their needs. Communication is essential of all nursing roles and activities. Manager. Nurse manager need to establish an environment for collaborative patient-centered care, provide safe quality care with positive patient outcome. A manager in other ways will be a head nurse or in charge of the unit, coordinate activities of members of nursing staff in delivering nursing care and personal policy. Then career development. Innovations in healthcare, expanding healthcare system and practice setting an increased need of the patient's habits stimulate for new nursing roles. Categories of nursing personnel. First one is the bedside nurse, the person who gives care to a patient in a hospital. A nurse working in an institution with the patients to provide direct bedside nursing care. Second, public health nurse or a community health nurse usually deals with the families, communities or health promotion, disease prevention and health restoration activities. You might have seen during the vaccination, the public health nurse come to the home, doors of each house and ask for any persons who has to be vaccinated during the polio eradication program. They all are the public health nurses. Then, industrial occupational nurse, a nurse working in factories, offices or companies for health promotion, disease prevention, health restoration activities or injuries. They are known as an industrial nurse. The military nurse, a nurse working in the military base, they are known as the military nurse. Then, private duty nurse, privately hired nurse to take care of someone in need. So, one person will be taking care of Means one nurse will be taking care of one person only, not anyone else. Only that patient they are especially hired. So they are known as the private duty nurses. Then independent nurse practitioner, a nurse who has completed an advanced level of specialized nursing program and certified to practice as an independent practitioner. This has been seen in the United States and all, and now in India it is coming up as an independent nurse practitioner. Then clinical specialist, a nurse who had completed master's degree in specialty and accountable clinical expert in the specialties. This nurse provide expert care to the individuals. Then being the specialties, the psychiatric nurse, pediatric nurse, cardiothoracic nurse, etc. Then nurse midwife, a nurse who completed a program in midwifery, provides prenatal and postnatal care and deliver babies to women with uncomplicated pregnancy. They are known as the nurse midwife. The nurse anesthetist, a nurse who completed a course of study in anesthesia school, carries out assessment of preoperative status of the patients. They ensure anesthesia and monitor during surgical procedures. Then nurse educator, a nurse usually with advanced degree who teaches in the clinical educational settings and teach theoretical knowledge and clinical skills and conduct research. They are known as the nurse educator. Nurse researcher, a nurse who is involved in planning, conducting and disseminating research among nurses to promote evidence-based nursing practice. They are known as the nurse researcher. Then nurse administrator, a nurse who functions at the various levels of management in the healthcare settings and is responsible for the management of administration, resources, and personnel involved in direct patient care. That is known as the nurse administrator. Nurse entrepreneur, a nurse who has an advanced degree and manage healthcare related business. They are known as the nurse entrepreneur. So, thank you for listening. If you have any doubts, any queries, please do respond to me.